So I have two practices, one here in Sheffield, and then the main practice is in Rotherham, which is about 10 miles from here. In a way, I was the last man standing. So workload has been quite intense, I'm afraid. Doing 6 or 7 sessions there and several sessions here, and covering the practice for emergencies and doing all the other work which we do when patients go home. It's been difficult, and obviously trying to maintain safe and effective and appropriate clinical care across 2 sites has been difficult. Various options were being considered, from merging with a neighbouring practice. Then Tom's letter came, and the way Tom came across, I still remember the conversation. I was walking in on a lovely summer's day. I don't know, it was my sixth sense. This company, they didn't look like they were going to try and squeeze every penny out of this practice. And they looked like they wanted to take the practice forward in the right way in terms of investment, clinical care, patient care, and all the innovative stuff what they were looking to try and do. And the way Tom came across, it just seemed very sincere and honest. Now it's been taken over. A lot of weight's been lifted from my shoulders because I don't have that final responsibility. If a nurse phones in sick, it's quite not my problem as it would have been before in a small practice. I can take annual leave and not worry about the practice, and that was a big problem because getting a locum for a single-handed practice which is small is extortionate. So those things are big wins, and obviously I don't have to worry so much about things like the QOF, the Quality Outcome Framework, the PCN-DES, the investment fund, the Super QOF, the quality contract. Above all, I don't have to worry about CQC. That cloud on the horizon is not my problem, if you know what I mean, you know? So that's a big weight off the shoulders. I can just concentrate on clinical care. The staff were worried about a new company coming, and we kept it quiet for a while until I was sure that I was going to go with Tom's company. But the staff have been really well looked after. I mean, and I mean that, because they've had their hours adjusted to what suits them, often more. They've had a pay review, which has helped them, and their contracts are more secure. One of the reasons why I kept running with this practice was because of them, because I was loyal to them and I didn't want to close the list and leave them redundant. The staff have been superbly accommodated. And not only that, as we've run with you guys, we've actually had to employ more staff, and there's never been any hindrance at all. For me, the biggest was when the building was sold, because I thought that was my problem over my head, which I couldn't ever move on. So that was my biggest relief. But then also just the relief generally that, you know, the investment which has come, and it came immediately, you know, from the garden to the CCTV to desks and ergonometry and all that. So we had a lot of positive feelings, and there's lots of things we just felt, oh, this has all worked exactly as as was said. Nothing has gone against what was being said. We've had a really positive experience, you know. Sometimes things can be too good to be true, and you always think hard about it. Offers which are being thrown across the table, thinking, well, this is not going to really happen. But from the beginning, from Tom's conversation that day to Zubair, to your IT, you know, guys from London who've come, from Dr. Ali, from your staff, and Dan, and even Kat, all of them, you've all worked so well with us as a team, and everyone's got the same aim, to provide patient care wherever we are in that team. The fundamental aim is to provide patient care. That's our job, and that's the most important thing, you know. And I've seen that within the organisation. And I think you're honest, you're professional, and you have patient care right at the top of your agenda. So I think that's what we worry when we're taken over, that we'll lose control of that, our clinical responsibility, and that's not happened with you guys. Yeah.